Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Today we're going to talk about how to prevent bad breath or halitosis. We're going to go into some of the causes and some of the preventative measures that you can take to help yourself. So let's get right into it. Causes. Bacteria produces volatile sulfur compounds, and the three compounds are called hydrogen sulfide, methyl mercaptan, and dimethyl sulfides. Now there's bacteria, especially at the back of the tongue, that can create this compounds or sulfur compounds that can create bad breath. So if you look at, let's say, a young child or even a dog, right, when they stick out their tongue, it's pink and wet. That's how it should look. So as we get older, we take antibiotics, and there's other factors that play into this, but it can look white or kind of like cottage cheese-like at the back of the tongue, and that is the bacteria that will create bad breath. Coffee, alcohol, and tobacco will increase these bacteria and also create dehydration. So dry mouth can create bad breath also. High sugar diets, because it increases bad bacteria, as well as candida overgrowth. Periodontal disease, GERD, or gastroesophageal reflux disease. If you can't digest your foods right, you feel like you're burping and you're always kind of looking for a soda or an antacid, GERD itself can create bad breath because of undigested food that can reflux back, and it could create a taste in your mouth, or you're burping a lot and also create bad breath. Recurrent sinus infections and postnasal drip. This is one that most people don't really understand, but postnasal drip, where you have allergies or persistent allergens that create a sinus infection or a nasal drip where you cough at night, right? That postnasal drip can also create an overgrowth of bacteria and create bad breath. So you want to look at those. Medications, okay? Hypertension medications, antihistamines, asthma medications like albuterol, acid blockers, right? Because you're not digesting your foods right if you're decreasing acid. Some antidepressants, they can also create bad breath because it creates dry mouth in some people. Antibiotics. If you're killing off bacteria, you can also kill off bad bacteria or good bacteria in your system, and it causes dysbiosis or imbalance of your gut flora, and that can also create bad breath. High protein diets. So people have a lot of protein, they're, let's say, working out a lot. That can actually cause ammonia smelling breath, right? Because of the amino acids. And then ketogenic diets can also create bad breath, and it almost smells like acetone, right? So with the keto diet, with the acetone smell, sometimes it'll go away given some time. Initially, when you are in a ketogenic state, you can have a taste in your mouth or a breath that smells a little bit like acetone. That might go away, but if it doesn't, you might want to change a few things in your ketogenic diet. So let's get into some of the preventative measures that we can take. Number one thing, use a tongue scraper. A tongue scraper is like this stainless steel tool, or they have plastic tools where you can go to the back of your tongue and scrape out the bacteria that's developing in the back of the tongue. So a tongue scraper is a great way to help minimize bad breath. Flossing 2 times a day and proper brushing is very important to prevent periodontal disease, gum disease, and so forth. Chewing organic parsley, mint, or peppermint. These are naturally antiseptic, but also it creates saliva, so that it prevents that dry mouth. You can also use xylitol gum if you like. Proper hydration. So dry mouth is one of the causes of bad breath. So for me, if I speak all day long and have a lot of consultations and making videos and doing all this stuff, as I start to dehydrate, my breath might smell a little bit. So you want to make sure you're hydrating properly throughout the day. You might also want to take betaine hydrochloric acid and digestive enzymes, because if you have reflux disease and you're not breaking down your foods properly, this can also help with the bad breath. Apple cider vinegar plays the same thing as betaine hydrochloric acid. If you take apple cider vinegar in small amounts before your meals, it'll help break down your foods properly. Taking probiotics, especially if you are on antibiotics, is to replenish that gut flora. Pineapple or pineapple juice has natural digestive enzymes in there, so if you incorporate some pineapple or pineapple juice into your diet, it can also help. Lastly, you need a dental checkup. You have to make sure you don't have any gum disease, periodontal disease, anything in the mouth that can create overgrowth of bacteria and create problems with the bad breath, right? So these are some tips and strategies that you can utilize, but I really feel like the tongue scraper could be a game changer for a lot of people, but all the other stuff can apply to you in order to help yourself, all right? So what I'd like you guys to do is comment below. I've been making a lot of videos of late, and tell me your success stories, because your success is my success as well as this channel's success. So I'd like to hear the positive stories, and we'll see you guys next week on the healthy side. Have an awesome day.